In our morning rounds, a look at how the vice president will lay out the game plan. He joins hundreds of experts, care providers, patients, and their families in Washington today. Thousands more are meeting in all 50 states.
The focus is on prevention, early detection, increasing access to treatment, and promoting data sharing. Our Dr. David Agus is taking part. He leads the Westside Cancer Center at the University of Southern California. He joins us now from Washington. David, good morning. We're going to talk about your wardrobe in just a second, but first we'll talk about why you're here. You know, President Nixon first declared war on cancer in 1971. Vice President Biden says we're at an inflection point, is what he said to Charlie a second ago. Do you feel like a breakthrough is very close now here in 2016?
Well, we're making progress. 45 years ago, when Nixon declared the war on cancer, we had chemotherapy and we had radiation therapy. Now we have new methods like molecularly targeted therapy, immunotherapy that Vice President Biden alluded to, and those really are changing some of the game. We certainly haven't won the war, but we're getting better at it. And, you know, it's difficult when a patient with cancer sees these big advances on the news. It's still most aren't benefiting from them. And the Biden approach is really powerful, and it's going to align all of us to do things quicker because patients need it today.
I know that you especially are passionate about data sharing. How will that change how we treat cancer?
Well, every cancer patient now is being treated, and it's an opportunity to collect data, where a cancer patient can be part of the solution, not the problem. And with the big advances that we've had in computing power, the ability to collect data, we can start to learn things. So a big data study came out recently showing that if you had ovarian cancer and you were on a beta blocker, which is an inexpensive drug for blood pressure, you live 4 years longer. Wow. And that observation from big data is now in clinical trials. So we're learning more and more. And with big data, hopefully we're going to make many new observations to allow us to personalize and treat each cancer as an individual instead of by body parts, breast, prostate, lung, like we're doing now. It really doesn't make sense.
David, President Kennedy sort of coined the term moonshot. It became, therefore, a term of art, meaning we have a big idea and a big goal in a limited part of time. What is the goal here, and how long will it take?
Well, you know, when I first met Biden in Davos earlier this year, you know, the first thing we said was, really, moonshot? Are we going to cure cancer in a couple of years? And he said, no. What I really want to do is take what it would have taken 10 years and make it happen in 5 years. Accelerate progress. And so the goal is really to break down the silos, as he said, is to get people to work together. There are remarkable people across the country working on cancer, and they've all worked individually. The goal now is to pull them all together. With the resources together, we can hopefully make a big impact for patients' lives because they need it.
So what's possible?
So what's possible now is to start to look at an individual cancer and identify the on and the off switches and use the right treatment at the right time in the right patient. And so by doing that, hopefully we can have really a major change. And so now we're all collecting our individual data, but by pooling them, there's going to be greater power. And so we need leadership. To get normative behavior change, you need leadership. And Vice President Biden is going to provide the leadership to break down those silos, hopefully.
Quickly, David, very quickly, why did you decide to wear a tie? I have never seen this look before in my life on you.
It's scary. I now know the issues of politics in Washington. A tie, blocks the circulation to the brain. But when the vice president calls, you put on a suit and tie.
Oh, very nice. You look very nice, Dr. David Agus.
Yes. Thank you.
Nice to see you.